Aspire, Strategies for Strengthening Adolescents' Sexual and Reproductive Health Role Modeling. This book explores how positive role models can help guide teenagers in making healthy decisions about their bodies and relationships. It focuses on the idea that people like parents, teachers, friends, health workers, and community leaders can influence young people by setting good examples. The strategies in this book were developed using a method called Aspire, which ensures fairness and effectiveness in applying these approaches. The book explains the differences between mentors, peers, and role models but shows how all can play a part in shaping teenagers' attitudes and behaviors. Peers, people of the same age, can share experiences and learn from each other. Mentors provide structured guidance and support. Role models, whether peers or mentors, inspire others through their actions and values. Since there isn't much existing research on role modeling in this area, the book adapts proven strategies to fit the needs of teenagers. It suggests practical ways for different role models to get involved, such as parents having open, honest conversations with their children about relationships and health. Schools and health workers encouraging peer education programs and youth-led initiatives. Media personalities and community leaders promoting positive messages. By using these strategies, the book aims to create a supportive environment where teenagers can learn and make informed choices. It helps fill a gap in research and practice, offering a fair and inclusive approach to improving young people's well-being. This book highlights role modeling as a powerful way to support teenagers in leading healthier lives. It encourages policies and programs that use role models to positively influence young people's choices. Chapter 1. Trends in Adolescents' Sexual and Reproductive Health. Adolescence, ages 10 to 19, is a critical time of physical, emotional, and social changes that shape behaviors, including those related to sexual and reproductive health, SRH. Globally, adolescents face challenges like high rates of unintended pregnancies, sexually transmitted infections, STIs, and limited access to accurate SRH education. These issues are worse in low-income regions due to poverty, cultural taboos, and gender inequalities. Traditional SRH programs often overlook the power of role models, like parents, teachers, peers, and media figures, in guiding adolescents' decisions. Role modeling can bridge gaps by providing relatable, trustworthy examples of healthy behaviors. However, barriers like stigma, lack of trained role models, and misinformation, especially online, hinder progress. Solutions include community-based education, youth-friendly healthcare, and digital literacy to combat false information. Effective strategies must be culturally sensitive, inclusive, and engage multiple stakeholders, ensuring adolescents get the support they need to make safe, informed choices about their SRH and future. Chapter 2. The Aspire Process for Adapting Equity-Explicit Implementation Strategies. Adolescents learn a lot about sexual and reproductive health, SRH, from role models like parents, peers, and media. Good role models help by sharing accurate information, encouraging open conversations, and reducing stigma around topics like consent and contraception. To make sure these strategies work for all teens, the Aspire process is used, a three-step method that adjusts SRH programs to fit different cultures and communities. Step 1 checks if the strategies make sense for the teens they aim to help. Step 2 looks for gaps, like whether some groups are left out or lack resources. Step 3 then changes the strategies to fix these gaps, making them fair and effective for everyone. By using real-world research and teens' feedback, Aspire helps create better SRH role models, ensuring all adolescents get the support they need in a way that respects their background and experiences. Chapter 3. Process of adapting the strategies for adolescents' sexual and reproductive health role modeling. This chapter explains how strategies for improving adolescents' sexual and reproductive health, SRH, through role modeling were adapted using the Aspire process, a three-step method ensuring fairness and effectiveness. The process identifies key strategies, examines gaps, and adjusts them to fit different cultural and community needs. 7 main strategies were refined. Encouraging open SRH discussions between parents and teens to build trust and guidance at home. Community-based SRH programs where local leaders and members actively mentor adolescents. Structured mentorship programs pairing teens with positive role models like teachers and health workers. Media campaigns using TV, radio, and social media to share accurate SRH information. Strengthening families as role models, helping parents discuss SRH topics comfortably. Engaging healthcare professionals as trusted SRH advisors in schools and clinics. These strategies aim to create supportive environments where teens receive reliable SRH guidance from trusted figures, parents, communities, mentors, and health experts, while respecting cultural and religious values. Chapter 4. Recommendations for Adolescents' Sexual and Reproductive Health Role Modeling. Adolescence is a time of growth and discovery, where young people form their views on relationships, health, and identity. Role models, like parents, teachers, peers, and even social media influencers, play a big part in shaping how teens understand sexual and reproductive health, SRH. This chapter explores how different role models can positively influence teens by promoting open conversations, healthy behaviors, and respectful attitudes. Parents can build trust by talking openly about SRH, while peer educators and social media campaigns can make these topics more relatable. Schools should teach inclusive, age-appropriate SRH education, and healthcare providers should offer youth-friendly, judgment-free services. Community and religious leaders can also help by sharing messages that align with cultural values while challenging harmful stereotypes. More research is needed on how digital influencers, gender differences, and cultural backgrounds affect teens' SRH choices. By working together, families, schools, health professionals, and communities, we can create supportive environments that help teens make informed, healthy decisions. Conclusion. This book highlights the power of role models in guiding adolescents toward better sexual and reproductive health, SRH, decisions. Teens learn from those around them, parents, teachers, peers, and even media figures, so having positive, relatable examples is key. The book introduces practical strategies like improving family communication, community programs, and mentoring to make SRH education more effective and inclusive. Using the Aspire process, it ensures these strategies fit different cultures and address inequalities, helping all teens, no matter their background. Role modeling isn't just copying behavior, it's about trust, support, and open conversations that break down myths and stigma. The book calls on everyone, families, schools, health workers, and leaders, to step up as role models. By working together, we can create a world where teens feel informed, respected, and empowered to make healthy choices. Change starts with us, let's lead by example. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology, and medicine.